Our patients are irrational and emotional, and explaining the evidence isn't really that helpful. I'm going to tell you the story of how I went to see a cardiologist. I've been having sharp, stabbing chest pains right over my heart for about 2 months, and they were getting more and more frequently until it happened one day while I was playing with the kids. It was really sharp, like I couldn't keep moving. So I went to ED, got monitored, everything was clear, ended up at the cardiologist appointment. Important social history. My biological father passed away quite young with a heart attack. And I had known that the CTCA, which is the coronary CT scan, is the gold standard to look at your coronary arteries. And that's the test that I was hoping to get this whole time. So I see the cardiologist, awesome guy, great bedside manner. And he says, look, there's nothing wrong. You're probably having some arrhythmias, maybe. It could be musculoskeletal. And to get a CTCA would be a waste because unless you're around 50 to 70% blocked, we wouldn't do anything. And you're probably not going to go on tablets right now for the rest of your life, are you? And to which I said, no, probably wouldn't. And then I was asking, but, what if it's 30 or 40% blocked? Not enough to show up on a stress test, which I passed, but just enough to go, hey, that's something to know about, something to worry about, something to do something about. He said, there's no indication. If you pass your stress test, it doesn't make sense. In other analogies, it's like plumbing and your pipes aren't blocked. And I laughed because he knew I was a physio. And I said, this sounds exactly like patients coming with back pain. They want to scan it. And we're like, there's no point. Like, even if it shows disc bulges or degeneration, that's just normal stuff. You don't need to worry about it. And you're not going to change what you do. There's no point. But we're irrational and we're emotional. And explaining the evidence is not that helpful, even when you're more educated like I am about these matters. And I found that fascinating being on the other side of that interaction. And this is why when you're really staunch in the evidence and some of the PhDs who just always explaining evidence, over-explaining, talking about why manual therapy is low value, all of those things really lack human insight and human connection and the human condition, which is sometimes we just want to be cared for, even if it doesn't do anything, even if the effects are mostly placebo, and even if getting the scan doesn't change much. We just want to know for the sake of knowing. And even in these instances, we don't know. We don't get the sake of knowing because we're just going to come out more confused, but I would just feel better. And sometimes our patients would feel better to have the scan and sit down with them and say, look, this is here, this is here, this is here, but I don't think it's the cause of your pain. It actually looks really helpful. Sometimes that's an easier path than having a patient who's sitting there for 6 weeks thinking, why isn't my physio ordering me a scan?